Great. And once again, thank you for joining today's webinar titled Reaching Indigenous Migratory and Seasonal Agricultural Workers through Language Access Services, hosted by the National Center for Farmworker Health. Something very quick, if you want to listen in Spanish, there is a language option below in the menu, so you can press there the Spanish or the Español, el canal en Español, so you can hear the entire presentation in Spanish. Okay, thank you very much. So for those of you who are not familiar with NCFH, we are a private nonprofit organization. We are located outside of Austin in Buda, Texas. And our mission is to improve the health of farmworker families. And we do that by providing different services like programs, training, and technical assistance, and other resources. We are very proud to be serving and collaborating with over 174 migrant and community health centers in our network. And also, for those who provide primary care services to agricultural worker families. So again, thank you very much for all the work that you do and for joining us today. And we want to invite you to become part of the Ag Worker Access campaign. This campaign started in 2015 as part of a joint effort between the National Center for Farmworker Health and the National Association of Community Health Centers, along with other health center staff and ag worker advocates. We knew that there was more that we could do for ag workers here in the United States. So the result of this effort is the Ag Worker Access campaign. So we invite you to become part of it. You can find more information about the campaign in our website, and also feel free to contact us for more information. So after today's session, we want you, the audience, to be able to identify language access challenges impacting Indigenous, migratory, and seasonal agricultural worker populations, also to adapt the service delivery to reduce the impact of language barriers in this very important population, and to improve the communication and health outcomes among the Indigenous ag workers. So these are the learning objectives for today. We are very excited to have Dr. Vivian Nuttig as our invited speaker and expert in the topic. And I want to share a little bit more about our invited speaker. Dr. Vivian Nuttig graduated from the University of Texas in Austin, which has a especially strong program in Indigenous languages of the Americas, graduating Indigenous linguists and anthropologists such as Dr. Emilia Cruz Cruz and Dr. Jaime Gonzalez Perez. Vivian has been working with Indigenous organizations in Mexico, Guatemala, and the United States since 1994. In the past 20 years, most of her work has focused on human rights, especially language rights and the right to freedom from territorial and gender-based violence. In her day job, Dr. Nuttig works in language access and language justice for Austin Public Health, which seeks to overcome and serve residents of Central Texas, home to speakers of more than 85 languages. And in her free time, she likes watching her teenage son play Ultimate Frisbee. Love that. Thank you, Vivian, for accepting this invitation and for sharing your knowledge with all of us today. So, and without further ado, I will pass it on to you. Vivian, I think you were in mute. Perfect.
Thank you so much. Thanks, Alex and Vanessa. And many, many thanks to the interpreter. I really appreciate the fact that this could be a bilingual presentation. And I also really wish I could acknowledge everyone by name who has contributed to the tools that I'm presenting today. It's been 30 years of working with teachers and organizations and institutions and friends that have really made the foundation of what I'm going to present. And I want to thank everyone for the worlds of knowledge and power that you've made visible to me. Next slide, please. I also just want to note that this is a challenging task because on the one hand, I want to be really loyal to um, the tradition of knowledge that goes back to before the arrival of the Spanish, and the history of Indigenous peoples that affects health and healthcare today and can make a difference in clinics. And then also on a much smaller scale, I want to offer practical tools for working in clinics. So you'll see that I go from sort of very large scale ideas to very, you could say, sort of micro strategies for how to improve the experience of Indigenous peoples when offering service provision. Next slide, please. You can go to the next slide. Thank you. So I want to just go to a anecdote from my work here in Austin at a health fair where we were offering vaccinations and health education to a collective of taxi drivers, most of whom were from many different regions of Africa. And I was there trying to get a sense of the different languages that were spoken there, because this is a population that we didn't get a chance to serve a lot. And I was using a language list tool, and I'll talk about that more later. And this man walks in the door and sort of sees what I'm doing. And he's like, "You're not going to have my language." He spoke English. But I pointed to the list of African languages on the tool. And at the very bottom, he looked at it and he said, "Kinyarwanda, you have my language." And later on, he walked up to one of the only women who was present in this space and said, "Finally, some recognition." And I think that this anecdote just speaks to the power of getting someone's language right, especially in a situation where, in a context where they could feel and could accurately feel where their language and their culture just isn't recognized as present. And here we're going to talk a lot about building relationships and building partnerships with patients. And certainly getting that language right is a great and important piece of that. Next slide, please. So the tools I'm presenting here, of course, take place within the legal framework of Executive Order 13166, which dates back to the year 2000. And this dictates that all federally funded agencies need to have meaningful communication with their clients, with the public, and meaningful communication using language access tools, interpretation and translation when necessary. And that goes back to Title VI of the 1964 Civil Rights Act, which was a result of the movement led by Dr. Martin Luther King Jr. and others, which guarantees non-discrimination on the part of federal programs against, of course, race, against people, whatever race they may have, but it also includes nationality as another way that people are prohibited from being discriminated against. And that's been interpreted by the courts to mean language. So this is also, it's the right thing to do. It leads to better health outcomes. It's also the law. Next slide, please. So right now I'd like to ask you all, I'd like to get a sense of who's here. And Alex, I'll let you go ahead and explain the poll.
Yes, thank you. So you will receive a poll now. It's going to be launch. And the question is, in a sentence or a phrase, how are you hoping to use the ideas presented in this webinar. En una frase, cómo es para utilizar las ideas presentadas en este seminario, you will, you will have an opportunity to just, type a phrase or a sentence and share that with us. And then after you answer that question, we're gonna share a little bit of your answers. But you should receive, very good, we're starting to get answers, great. Okay, we're gonna give you a couple more seconds. Okay, very good. We're starting to receive those answers. We have 9 already. Great. Great. So we have a good sample. Those keep coming. Perfect. And I think we're good to share. And then again, if you want to also keep sharing with us the using the chat box, perfect. You can totally share that with us. Okay, great. Okay, just to make sure that we receive those answers, Vanessa. Great.
I'm not seeing the results. Let's see.
We're gonna, so I mean, if you want to share also throughout the chat, maybe just one or two sentences or phrases, you can do that, and I can totally help sharing that with Dr. Vivian and the audience. Okay, I see some answers there. Our individual results continue to pop up. Oh, okay, perfect. They say that the results continue to pop up on their screens. Okay, oops. About that.
Hmm.
So what we can do is we're gonna keep moving to the next slides, and then I'm gonna definitely look for those answers and share those with you, Vivian, and the
Okay.
audience.
Okay, sounds good.
Perfect. So we're seeing some here at the chat. If it's okay, then Vivian, to share those with you. So Susan shared with us that learn tips and resources to share with our partners across the state of North Carolina. She works on providing language access support in University of North Carolina in Chapel Hill. Jose shared with us that he will use the information to improve and better support members of the indigenous community in the central coast of California. Joshua also shared with us to improve language access in the implementation of digital, social, and health-related resources like phone-based apps, and how to educate around digital literacy, which is provided. Some others doing outreach with farm workers in their public health clinic and working with other agencies pursuing a language access plan. Very interesting. Also, Roganuel shares with us he expect to learn much and share that with the indigenous community in California as well. Great, thank you for sharing that using the chat. Thank you very much.
Thank you. Those are exciting and wonderful answers. You can go ahead to the next slide, Alex.
Perfect.
So these are what I'm calling the interdependencies of language access. And I'm not presenting them as steps because they should really be going on at the same time. So you can be ready to care for Indigenous people when they come to your clinic, or you want to start doing outreach. I'm focusing mostly on making those partnerships with patients here, but really finding the funding, doing the planning, doing training, and finding tools, which, you know, check for training and check for tools for today. And then also reaching out to those Indigenous language interpreter organizations and making sure that you have pre-arranged with an appropriate organization for the folks in your region or in your state, so that you're not scrambling at the last minute to get an interpreter, is also a key foundational piece to being ready. So you can go ahead to the next slide. So now I'm going to start with like those big picture like frameworks that will help you with thinking about serving Indigenous people. And one of those is thinking about the diversity among Indigenous people. What comes to mind, I put several on this list. There could be many, many others. This is based on my experiences and the folks that I've worked with. Gender identity, African descendancy, artistic community, formal and or informal education, nationality, hometown and region and regional history can all be very important. Religious affiliation and political affiliation. And this could even, these differences, of course, could be very true even of folks from the same hometown and from the same region, some of these. So of course, we never take one person as representative of a whole group. And this is the case with Indigenous people. And the next slide, I'm going to go into thinking through trauma and trauma-informed care when we're building relationships. And really, violence against Indigenous peoples, as we know, has taken place since 1492, since the arrival of the Spanish, and has been documented back, you know, in the 1500s. I have a quote here from Bartolomé de las Casas writing to the crown. You know, fast forward to massacres of Mayan peoples in Guatemala, more than 600 villages destroyed by the Guatemalan army. And, you know, of course, right now, people are surviving very difficult conditions because of drug trafficking in their home countries, because of assaults, kidnapping, sexual assaults on their journey here. All of these are important to take in mind when we're thinking about how to approach discussions about health. Okay, next slide, please. And one kind of violence that maybe isn't spoken about enough is violence against knowledge or epistemic violence. And here in this slide, I focus a lot on the Maya in my talk. It is the group, you know, of course, in Mexico and in Guatemala, 29 languages that I know best, but this is applicable to other indigenous groups throughout the region of Mexico and Central America. But with the Maya in particular, there were hundreds of books, they're called codexes, written in a fully developed Mayan language, when the Spanish arrived, that, and almost all of them, all but 7 or so, were burnt by Fray Diego de Landa in 1562. And what we really have there was, we know about Mayan astronomy and the calendar, the invention of, or you could say the discovery of zero, all this knowledge that that lives on in one way or another, but it's very hard to reconstruct and to trace in an effective way, because of that violence against it in 1562. Next slide, please. And at the same time, we also know that all along there have been, protests, uprisings. Indigenous people have been aware of what is being done, and that is also something to keep in mind. We don't want to just think of people as constantly victimized, but also as resilient. And that's something, of course, we see in the act of migration. Next slide, please. So I want to dig a little deeper into these different theories of sickness and in health, which is part of other knowledge systems, and I'll go into some of the work that I did with 3 women who had been sexually assaulted by the Mexican army in the context of war in 1994 in Chiapas. And they went 25 years without the Mexican government ever acknowledging that their claims were true, even though at the level of the International Commission, the Inter-American Commission on Human Rights, their claims were sustained as true. And one of their main, this is a direct quote from them, I'm not going to read it, but their main claim was that they were made physically ill, not just that they were sick of being called liars, but they were made physically ill, and they were physically ill, especially the leader of the 3 and their mom suffered greatly and would go to both sort of Western medicine hospitals and do home-based remedies, and was made terribly sick. And this is quite common. There's in Indigenous theories of health and healing more of a mind-body connection than Western medicine really allows. And you've probably heard of Espanto, or the theory that adults and children can be made sick by having a terribly frightening experience. And that's something to be aware of course, when working with Indigenous folks. And when working with interpreters, it's important to keep in mind that thank you, somebody added susto. Yeah, that's another word for that. So this is something to keep in mind when working with Indigenous interpreters. They may need to really do a bit of an explanation when they're interpreting between Spanish and an Indigenous language, or between English and an Indigenous language, because there aren't one-to-one equivalencies between, let's say, a system we might take for granted in the body, like your cardiovascular system, and then there might be several sentences of explanation to come up with an equivalency for that in a Mayan language. Next slide, please. On the other hand, keep in mind positive experiences with home-based healing that could maybe have people not wanting to go to the clinic. This could be positive experiences with herbal remedies, the comfort and healing that can take place in like essentially home steam baths called temazcales or chus, as well as at home altar religious healing ceremonies. Okay, next slide, please. Okay, do you want to go ahead and
Yes.
present the poll?
We have one more poll. No, this question says, of the big picture facts that Dr. Vivian has presented above, which do you find most relevant? Which do you find most relevant for understanding Indigenous patients? And you're going to see multiple answers. You can pick more than one. You can pick multiple answers, and we're going to share those with you. De los hechos generales presentados anteriormente por la doctora Vivian, ¿cuál le parece más significativo para comprender a los pacientes indígenas? Y puede elegir varias respuestas. I'm going to give a couple more seconds to receive those answers. Great. And also, if you want to share using the chat, I see that Monica has shared some with us, all of the above, todas las anteriores, but we're gonna showcase all of these questions now. Perfect. So we see there are multiple answers. I think all of the above, todas las anteriores, is the one with more responses, followed by different theories of health and diversity among Indigenous people. If you want to add something to it, Vivian, feel free to.
No, that's useful. Thank you.
Great, perfect.
Okay, next slide, please. Okay, so now I'm going to narrow the focus to a tool which is called a list of language keywords. Before I dive into that, I want to present you with this three-step process that you would absolutely need to follow if you're going to work effectively with speakers of Indigenous languages. And the first one would be to identify the language keyword and and document it, right? Because you're going to be using the language and document the hometown. And then you're going to be contacting the Indigenous Language Interpreter Organization. And do you have that directory open, Alex, to show folks?
Yes, I can share that with you in a moment.
Okay. So what I have heard from Indigenous language interpreter organizations is that they will have on their intake form, so what language does this person speak? And then sometimes people will not fill out the hometown question. And as I explained before, some of these language can have what we're calling languages are actually a group of languages. So if you just put in the name of the language keyword, there may be 10 actual, we'll call them variants of that language. So they won't know how to get you a good match for that interpreter, for that patient, because they need to, with the hometown, then they can figure out using their network, which exactly variant of that language they need. So find the language keyword, document the hometown, and then reach out to the Indigenous language interpreter organization. So here we have, this is the keyword language list for working with Indigenous language interpreter organizations. And you'll see that it's organized by country. And I'm just going to I'm going to explain some elements of this. You'll notice that I am calling it a keyword list. And that there's several reasons I'm calling it a keyword list. One is that, excuse me for one sec. One document closed up on me. As I said before, some of these words can represent 5 to 10 mutually unintelligible languages. So it's a little bit deceptive to say, oh, this is a language, because that's not quite right. Then another thing that I want to point out is that these languages, and I've listed them all in Spanish because that'll just be easier for everyone. There's also a word for this language which is spoken, like if you're speaking the language, you'll use a different word for the language. So if you look at in the Mexico column, if you see, go down to Maya Yucateco, it's in alphabetical order, and then you see / Mayatan. So Mayatan would be the language, would be the name of the language used when you're speaking Mayatan or Maya Yucateco. And I also just want to let you know this is not an exhaustive list of all the languages spoken in Mexico and Guatemala or Latin America. And I would encourage you to, of course, this is for reaching out to the Indigenous language interpreter organizations. When you need an interpreter, they are the experts about the complexity of the variants that I was describing, and those relationships are very important to really making this list work for you. And I hope to turn this into more of an improvable, like, living document. Right now, it's obviously a PDF, and I invite you all to use it in your clinics. But it should be something that can be improved and commented on. So there's that. So I want to dive into a little bit about the pronunciation, because I think this causes confusion and curiosity in folks. You can see the apostrophe that's included in the spelling in some of these words, and the apostrophe it's called a glottal stop. And like if you look down in the Guatemala column, if you go down to Itza, under I, yeah, thank you. So the glottal stop is essentially when you close your throat as if you are, like in English, we do this sound a lot. It's when, like if you say no, like that closure of the throat, that brief closure of the throat, everybody just do it. And you can do, in Spanish, people do this too. So the interpreter is also doing this in Spanish. So that little quick closure, one closure of the throat is the glottal stop. And so that apostrophe is kind of like a letter representing that sound. So itza, that's the glottal stop. That's the closure. So you can, it's a lot easier to do. Obviously, if we, in English and Spanish, we don't have that sound in our alphabet. But it's easy to do if it's on the end of the word. It can be harder to do if it's in the middle of a word, but go ahead and practice that. And this list on a most basic level can be important for differentiating languages from each other. There was a case that I learned of where there was a person who had quite an important need for an interpreter, And for a while, there was confusion about whether they spoke, and this is in the Guatemala column, Quiche under K or Quechua under Q. And so if you do have a list like this, you can, based on the pronunciation, you can kind of figure out, oh no, it must be, in this case, it was Quechua. And perusing this list, you can get used to, there are spellings like with the TS or the TZ that are not that common in English or Spanish. So I think that is all I'm going to say for now about this tool. I hope you find it useful. Next slide, please. Okay, so let's try this. Go ahead, Alex, if you want to explain this.
Yes. So we're gonna do a little bit of an interactive activity here. You're gonna you can use your smartphone or smart device. You can scan this QR code. It will take you to a Mentimeter. So we're asking this question: what indigenous language is spoken in your clinic, region, or state? ¿Qué idiomas indígenas se hablan en su clínica, región o estado? So when you scan this QR code, or if you use the link that will be shared in the chat, and you will see 2 to 3 options for you to enter languages. So if you are able to do that, please share with us what indigenous languages are spoken in your clinic or your region and state. And we're gonna see a word cloud now after you sharing those words with us or those languages with us. So we're gonna give you a couple more seconds to scan that QR code or using the link. There we go. There we have the link in the chat. So now I'm gonna activate the word cloud. So as you start putting those answers, some of those languages will start popping out in this word cloud, and it will give us an idea of what languages are you working with, or what the your patients, your indigenous workers, etc. What are the languages that you are seeing in your population? Let's see if we get some responses. See really quick about that. Okay, perfect. I'm trying to see if that. Okay, so here I am seeing, let's see if I can share that with you here in this. We are receiving some responses. We have 10 so far. So we have Spanish, we have many others. And please let me know if you're able to see those responses in the screen. Perfect. Great. So yeah, so as you start adding more answers, if the answer is repeated, so you will see that it gets bigger. So we can see there that Spanish is one of the main languages, but also Mixteco, Zapoteco, and then some other languages as well. We see Quiche, Haitian Creole, Mixtec. We have really nice responses there. Thank you very much. Perfect. Thank you for sharing those with us.
Yeah, that's really nice to see. Thank you.
Then can we move on to our next slide? Great.
Okay, so now I'm going to dig a little deeper into the working with the Indigenous language interpreter organizations. Alex, are you able to share the directory?
Yes, let me pull that out really quick.
Okay, I'll just talk as you're pulling that up. So as I said before, ideally you are getting a sense of the languages that are spoken by people who are going to be needing your services or even in your region. So you would be able to look on this directory, which specifies in the first column, there's the organization, and then in over, there's a language column, the fifth column, and there you can see sometimes they're specifying specific languages, and sometimes it's like others available on request. So you would want to reach out and find out if these organizations are speaking the language that you're looking for. And these are there's a great variety of Indigenous languages, and there's a great variety of Indigenous languages covered by these organizations. And this particular directory is available on the NCFH website, and it's a fantastic resource. Okay, could we go back to the slide deck? So another really fantastic practice for trying to get more of a sense of how to create a welcoming environment is follow these organizations on social media. Many of them are very, very active on social media, where they're creating content in Indigenous languages. They're showing successful events that they have put together where they've brought out their communities, a lot of times for public health events. And so you can also see that like best practices in action about specific language communities. Okay, next slide. And this is a really great directory. It's kind of an addendum to the previous directory where you can see all those organizations which were listed. Here you can see where their handles for Facebook, Instagram, Twitter, and then also their website. And I'm going to show you some examples of the work that one of these organizations does, which I think is really exemplary. Okay, next slide, please. So these two videos I'm going to show you are from an organization called Pueblo Unido. It is out of Portland, and the first Facebook video is it's really great for a number of reasons. First of all, the content that they've chosen. The content that they've chosen here is about a rent relief program, and of course, this kind of content, we know that there are housing crises going on in cities all over the country, and rent relief is high on the list of public services that people need. So it's getting the word out about the rent relief program. Then we look at what they did. So in terms of their use of language, they're having a voiceover announcing the program in Quiche, but they have subtitles in Spanish. And that is absolutely a best practice. We don't really want to dedicate our funds to doing document translation into Indigenous languages because of the kind of like knowledge violence that I described before. Literacy in Indigenous languages is pretty rare, whereas word of mouth is really something that you should be relying on for getting people out to events and spreading the word about your services. So go ahead, let's go ahead. We're just gonna watch the video briefly. And we're not gonna have the interpreter speaking over it. You'll see the subtitles are in Spanish. And this is Quiche.
Chirrihun sobaj eto banela chechri utojik riqahom taqhak orbal pa Oregon lekabish chech pa kashlantzig OERAP tajinka kikam taq riwujil wene rajawashikne katoikche utojik rihak orbal qahomla kimajbej ukulashik taqwa wewuj pariqij huwinaq waqib rechriik enero Reri hunam huqo huwinaqkeb wene rajawashikne katola utskok palikimbal tzib oerap.oregon.gov.
Great, thank you. And also on the right, you'd have to press see more to see it, but they also had just the very basic information actually in English and Spanish. Okay, now this next video, there's no subtitles, and this was a project, Semillas de Acceso, where a community had requested services of the organization, and this was an announcement about a big community gathering. At the gathering, I found out they had marimba, which is a particularly beloved instrument in the Mayan communities that I know of, and this is in Mam. And you'll notice here that it says Mam de Todos Santos, which is again the hometown practice. There are several different kinds of Mam that are not mutually intelligible. So this interpreter is speaking Mam de Todos Santos. And they did get, I think, if I recall, they got like 75 people out to this event. We're just going to listen to, a short clip from this video because it is only in Hmong.
Estochtnamte Lincoln, Oregon. Sul tochtnel Walta tochtnam Lincoln, semillas de acceso, juniqih yanchha, te enteraqashal, atwaqt alqantiqah chipamal, ish alpabahun chrata, tuyahni música andina, ish suhum ishbel folclórico, ish suh marimba nocte primaveral de Guatemala. Sul qanjo amlante che, tonche schnatzante un programa legal yanchha te enteraqashal dichuch, ish te campaña de justicia de Yol indígena.
Great. Thank you, Alex. So we can go to the next slide, please. So I had mentioned word of mouth. It's so important in understanding community dynamics. And in the next slide, I want to talk a little bit about other community dynamics to take into account. One thing, and you can go to the next slide, Alex. One thing to really keep in mind is reputation, and getting it right so that people feel that, I had mentioned bad experiences with clinics in hometowns or home countries. So how can we turn that impression around, honor commitments, try to understand and cooperate with community expectations? I know this is just sort of a basic public health outreach measure, and understand dynamics of mutual support and conflict at the same time. So, communities aren't are always going to be very complex. And of course, good work takes time with these communities, but it will be so worth it if when you can form a partnership. Okay, next slide, please. With language identification, this can often be very difficult with Indigenous communities because of racism against Indigenous folks, both in their home countries and in the US. There's a lot of racism by Spanish-speaking folks who aren't Indigenous against Indigenous folks. So you can find this on work sites. It's well documented. So why would I want to tell you in a health clinic that I speak an Indigenous language when I can kind of get by in Spanish, but at a certain level of health difficulties, that won't work, and you really will need to know the Indigenous language of the person. And I'm getting notes on time. Thank you. I'll probably speed through a couple more slides. There's also the expectation that no language services are going to be available. That is a perfectly rational expectation. It is very rare that language services are available in Indigenous languages, but we're working to change that. And then, of course, there could be previous bad experiences with language access, like, for instance, this article about people at the US-Mexico border and a very glitchy app that I guess Customs and Border Patrol has that really doesn't work at all well for Indigenous languages. Okay, next slide, please. I think with this poll, we will go ahead and skip this poll for this sake of time. And now I'm going to widen the lens again a little bit to just talk about social determinants of health back in the region where I used to work. Alex, if you could share the nativeland.ca map. This is a really wonderful resource where you can actually go and we won't do this now, but if you see in this, so you don't have to type anything into search, but you see in the search field, you can just type in your address and you can find out essentially whose territory you're on. We're not going to do that today, but instead, if you could type in where it says Batsilkop. So this is already set for the Seltal region, but why don't we go ahead and type in Ixil, I-X-I-L. And this is a language originally spoken in Guatemala, but also spoken here in the States. I know some folks in Ohio, for example, who are Ixil speakers. So if you if you zoom out, you can see, you know, where this is in relationship to Mexico and Guatemala and Central America. And then, yeah. So, and then if you wanted to go to Seltal, you could, which is the region where I worked, Tzeltal. And they're using Batsilkop, which is, as I said, the language name used by speakers. And there's a wide and complex region here for Batsilkop, which is Seltal. And I'm going to talk a little bit about that region and health facilities there now. So if you could go back to the next couple slides. I'll skip this slide, and I just want to tell you, like, in the region where I worked, people had to walk 1 to 12 hours to the nearest hospital. Next slide. Clinics were not welcoming places. For example, the COVID-19 vaccination campaign, this is in the Celtal region, was overseen by Army soldiers. Could, of course, could have a very tense situation. Next slide. And finally, staff, doctors and nurses would have these long held beliefs about Indigenous people's backwardness or ignorance or dirtiness, would not be interested in learning Celtal or theories of sickness and health. Next slide, please. So just to really emphasize, be open to alternative theories of health and illness, be aware of trauma and trauma-informed care, including trauma around language, and build awareness of Indigenous language, on your team, in the whole institution. And now for the last summary, I just want to quickly give an overview of what I've tried to impart today. Just a historical understanding of Indigenous language access in context, current barriers to healthcare and social determinants of health in people's hometowns and regions, which can affect their attitudes, of course, their expectations when they're here. Some tools, the language keyword list, the directory of Indigenous language interpreter organizations, the awesome social media directory, and the planning ideas. Okay, so I'm going to leave it there. I just want to thank everybody so much for the work that you all do and acknowledge it's hard work and invaluable work.
Perfect. Thank you very much. For those of you who are joining us through the video recording, this ends the content of the webinar. For those of you who are joining live, please stay for some additional resources that we're going to share with you.